actually very excited about the opportunity for the medical field to get a little more education into implicit bias. Going through medical school and training way back, caveman era, we didn't consider bias as a thing, as anything to talk about or to discuss, and that was very unfortunate. Not just for those of us who are professionals going through the system and having to endure the biases in that avenue, but for all our patients as well. And we got to see firsthand the differences in outcomes. But I think right now, the most important thing addressing the biases is the impact we're going to be able to have with bias in the forefront of our minds, not just as looking at outcomes and trying to figure out, well, gee, I wonder why this happens. I wonder why maternal morbidity or infant mortality is so much higher in one population or another, but actually being able to think about it and have an impact on it purposefully. I think right now, the whole purpose of us taking care of women is to improve their health. And maternal health really starts with preventing disease and optimizing their health, not just maternally as they're already pregnant, but before conception. And that's prevention, that's preventative health. And as it stands, disadvantaged populations, unfortunately, don't even have the opportunity to care about preventive health because it's so far in the back of their mind, it's not on their radar. There are so many things that they do have to worry about between work and children and violence, whether in the home or outside the home, that getting food on the table is a whole lot more important than getting a mammogram or a pap smear or whatever is getting their own health in check and optimized before they get pregnant. So really it's up to us as medical professionals to bring preventative health into their forefront and within their grasp, within their reach, and within the forefront of their mind. The way we have to start that in the pre-pregnancy phase is by focusing on or helping women focus on optimizing their mental health, their sugar, their blood pressure, their safety in their environment, helping them understand about contraception so they can timely, fix the timing of their pregnancies. Is this a good time for them? Is it too close to the last baby? Is it not a good time for their weight? Do they still need to lose a few more pounds to be optimal so that when they gain that baby weight, it's not too much to lose? There's so much else that they need to work on and to take care of themselves, their own safety and sanity before getting pregnant. All of that will prevent and minimize the morbidity and mortality that happens during pregnancy. So that's really our role, and realizing our biases in not providing preventive health to disadvantaged communities is going to help reduce that morbidity in these communities.